Here are 20 of the most commonly missed certified nursing assistant questions. Can you get them right? These are the trickiest, most confused rules, and the numbers people most often misremember. Read each question, then answer before the 5-second timer runs out, and then see why. This is exactly how you practice on PrepPass.org. Let's begin. Question 1. While giving perineal care, a CNA notices the room door is open and visitors are walking past. The CNA should first, A. Continue care quickly to minimize exposure time. B. Move the resident to the bathroom mid-task. C. Close the door, pull the privacy curtain, and cover the resident with a bath blanket. D. Ask visitors in the hallway to look away. The correct answer is C. The right to personal privacy and dignity during care is guaranteed by 42 CFR Section 483.10e and California HSC Section 1599.74. Best practice is to close the door, pull the privacy curtain, and drape the resident with a bath blanket exposing only the area being cleaned. Question 2. A resident in a California skilled nursing facility refuses her scheduled bath. The CNA should A. Bathe the resident anyway because hygiene is medically required. B. Honor the refusal, document it, and notify the charge nurse. C. Tell the resident she will lose her dinner privileges if she refuses. D. Have 2 staff hold the resident still and proceed quickly. The correct answer is B. Under 42 CFR Section 483.10a and California HSC Section 1599.65, residents have the right to be treated with dignity and to make choices about care, including the right to refuse treatment. Question 3. A CNA is discussing a resident's diagnosis with another CNA in the hallway near the elevator. This is a HIPAA confidentiality violation. Discussions must occur in private and only with those who need to know. B. Acceptable because both are facility staff. C. Acceptable as long as the resident's name is not used loudly. D. Acceptable when the elevator door is closed. The correct answer is A. HIPAA, 45 CFR Section 164.530 and 42 CFR Section 483.10 require minimum necessary disclosure and reasonable safeguards. Discussing PHI in public hallways violates confidentiality even between staff if others can overhear and the second staff member does not need the information for care. Question 4. A resident is in airborne plus contact isolation for COVID-19. Required PPE for routine care includes A. Surgical mask and gloves only. B. Gown and gloves only. C. N95 respirator, fit tested, or PAPR, eye protection, goggles or face shield, gown, and gloves. D. Standard precautions only. The correct answer is C. Per updated CDC/CDPHSNF guidance, COVID-19 care requires N95 respirator, or PAPR, for staff entering the room because aerosol generation can occur, plus eye protection, gown, and gloves. Question 5. After removing gloves, the CNA should A. Perform hand hygiene immediately before touching anything else. B. Reuse the gloves on the next resident. C. Wait until after the next task. D. Place used gloves in a pocket. The correct answer is A. CDC and WHO 5 moments require hand hygiene immediately after glove removal because microbes contaminate hands during use and doffing through microtears and during the removal process. Reuse B. Cross-contaminates, delaying hygiene. C. Spreads pathogens, pocketing. D. Contaminates uniform. Question 6. Which is not a least restrictive alternative to a physical restraint? A. Low bed with floor mat. B. Bed/chair alarm and frequent rounding. C. Wedge cushion to maintain alignment in a wheelchair. D. Tying the resident's wrists to the bed rails just in case. The correct answer is D. Least restrictive interventions include low beds, floor mats, alarms, scheduled toileting, recliner positioning, activity engagement, and environmental modifications. Question 7. Proper order for donning PPE before entering a contact plus droplet isolation room is A. Hand hygiene, gown, mask, goggles/face shield, gloves. B. Gloves, gown, mask, goggles. C. Mask, gloves, gown, goggles. D. Goggles, gloves, mask, gown. The correct answer is A. CDC PPE donning sequence is hand hygiene gown mask/respirator goggles or face shield gloves, gloves pulled over gown cuffs. Doffing is in opposite order, gloves goggles gown mask, with hand hygiene between steps and again at the end. Question 8. When transferring a resident with right-sided weakness from bed to wheelchair, the CNA should position the wheelchair A. On the weak, right side. B. On the strong, left side, at a 45 degrees angle to the bed, with wheels locked, footrests up. C. Behind the bed. D. Across the room. The correct answer is B. Position the wheelchair on the resident's strong side at about 45 degrees to allow weight bearing through the stronger leg during the pivot. Lock wheels, raise footrests, and apply a gait belt for control. Question 9. The accepted adult normal range for blood pressure is approximately A. 60-90/40 to 60 mm of mercury. B. 140 to 180/90 to 120 mm of mercury. C. Systolic 90 to 120 mm of mercury and diastolic 60 to 80 mm of mercury. D is systolic above 180 mm of mercury. The correct answer is C. Normal adult resting BP is roughly systolic 90 to 120 and diastolic 60 to 80 mm of mercury, per AHA fundamentals. Question 10. Lateral, side-lying, position with pillows supporting head, back, top arm, and between knees is used to A. Relieve pressure on the sacrum and heels, support proper alignment, and prevent hip adduction. B. Maximize aspiration risk. C. Increase pressure on the trochanter. D. Compress the dependent shoulder. The correct answer is A. Lateral position with appropriate pillow support relieves sacral/heel pressure, alternative to supine in the Q2H turning schedule, maintains spinal alignment, and prevents hip adduction, pillow between knees, and shoulder compression, top arm pillow. Question 11. For a cognitively intact resident, the most commonly used pain scale is A. PAINAD, for dementia. B. 0 to 10 numeric rating scale, 0 equals no pain, 10 equals worst imaginable pain, or Wong-Baker faces. C. FLAC, for infants. D. Glasgow Coma Scale. The correct answer is B. For verbal cognitively intact adults, the 0 to 10 numeric scale or Wong-Baker faces, useful for limited literacy or language barriers, is standard. PAINAD A is for advanced dementia, FLAC C is validated for infants/young children, Glasgow D measures consciousness, not pain. Question 12. A facility may transfer or discharge a resident only for specific reasons listed in federal regulations. Which is not a permissible reason under 42 CFR Section 483.15? A. The resident's clinical needs cannot be met by the facility. B. The resident or family filed a complaint with CDPH or the Ombudsman. C. Non-payment after reasonable notice, with limitations under state law. D. The facility ceases to operate. The correct answer is B. 42 CFR Section 483.15, C, lists the only permissible reasons for involuntary transfer/discharge. 1. Clinical needs cannot be met. 2. Health no longer requires SNF services. 3. Safety of others endangered. 4. Health of others endangered. 5. Non-payment after reasonable notice. And 6. Facility closure. Question 13. Under HIPAA 45 CFR Section 164.512, a CNA may disclose PHI without the resident's written authorization in which situation? A. Posting a cute patient story on social media without names. B. Telling a neighbor about a resident's diagnosis. C. Reporting suspected elder abuse to APS or the LTC Ombudsman as required by California mandated reporter law. D. Sharing chart details with a journalist for a human interest story. The correct answer is C. 45 CFR Section 164.512 permits disclosure of PHI without individual authorization for specified public interest purposes, including reports required by law, such as elder abuse reports under WNI Section 15630 and child abuse reports under PC Section 11166, public health activities, judicial proceedings, and law enforcement subject to limits. Question 14. Negligence in nursing care requires proof of 4 elements. Which is the correct list? A. Duty, breach of duty, causation, and damages. B. Intent, harm, witnesses, and police report. C. Insurance, supervision, training, and apology. D. Documentation, signature, witness, and seal. The correct answer is A. The common law elements of negligence, California Civil Jury Instructions, CACI 400, are 1. Duty. The CNA owes a duty of care to the resident. 2. Breach. The CNA failed to meet the standard of care expected of a reasonably prudent CNA. 3. Causation. The breach caused the harm. And 4. Damages, actual injury or loss. Question 15. A resident who is profoundly deaf communicates in ASL. To explain a transfer procedure, the facility should A. Have the CNA write everything on a small whiteboard at speed. B. Use family members to sign. C. Provide a qualified sign language interpreter, in person or via video, for substantive clinical communication. D. Speak slowly and loudly so the resident can lip read. The correct answer is C. The ADA, 28 CFR Section 35.160, requires effective communication, which for many deaf individuals means a qualified ASL interpreter, not written notes, which assume English literacy, or family. Lip reading captures only about 30% of speech and is unreliable for clinical content. Question 16. A nonverbal resident with end-stage dementia grimaces, moans, and guards the abdomen during repositioning. The CNA should interpret this as A. Normal behavior, no action needed. B. Attention-seeking. C. Possible pain, stop care, ensure safety, and report to the nurse for assessment using a tool such as PainAd. D. Hunger. The correct answer is C. Nonverbal cues, grimacing, moaning, guarding, withdrawal, tense posture, are valid pain indicators in cognitively impaired residents, assessed with tools such as PainAd or FLAC. The CNA must stop non-essential activity, ensure safety, and notify the nurse for assessment and analgesic decision. Question 17. A resident with Parkinson's disease has shuffling gait, a forward stoop, and freezing episodes. Which intervention best reduces fall risk? A. Walk briskly to encourage the resident to keep up. B. Use visual cues such as floor tape or counting cadence, 1 to 2, 1 to 2, and allow extra time during freezing. C. Carry the resident from room to avoid all ambulation. D. Insist the resident only ambulate after the morning dose without breaks. The correct answer is B. Parkinson's gait freezing responds to visual or auditory cues, tape lines on the floor, counting aloud, or a marching cadence helps reinitiate movement. Rushing, A. Increases falls. Carrying, C. Eliminates therapeutic movement and is unsafe. Question 18. A resident with expressive aphasia after a stroke struggles to find words. The best CNA approach is to A. Allow extra time, use simple yes/no questions, picture boards, and avoid finishing sentences for the resident. B. Speak loudly and slowly as if the resident is hearing impaired. C. Avoid talking to the resident to prevent frustration. D. Insist the resident write out every request in full sentences. The correct answer is A. Expressive, Broca's. Aphasia means the resident understands but has difficulty producing speech. Best practice, allow processing time, use simple closed-ended questions, offer picture/letter boards, and let the resident finish their own thoughts. Question 19. Under California Welfare and Institutions Code Section 15610.07, which of the following is not a recognized form of elder abuse? A. Physical abuse including unreasonable restraint. B. Financial abuse such as taking the resident's pension check. C. Neglect and self-neglect. D. A resident voluntarily refusing a piece of dessert. The correct answer is D. WNI Section 15610.07 defines elder/dependent adult abuse to include physical abuse, Section 15610.63, sexual abuse, neglect, Section 15610.57, financial abuse, Section 15610.30, abandonment, abduction, isolation, and the deprivation of goods or services necessary to avoid physical harm or mental suffering. Question 20. A nonverbal dying resident grimaces, moans, and pulls away when turned. The CNA should A. Assume no pain since the resident cannot describe it. B. Withhold turning to avoid causing pain. C. Tell the resident to relax. D. Report observed pain behaviors to the nurse promptly so PRN analgesia can be administered and the plan adjusted. The correct answer is D. Pain in nonverbal residents is assessed by behavior, grimacing, moaning, guarding, restlessness, tachycardia, withdrawal. Validated tools include PainAD, pain assessment in advanced dementia. Those are 20 of the most commonly missed CNA questions. This is exactly how you practice on PrepPass.org. Read, guess before the timer, then see why. The full free question bank for your exam is there. Just search PrepPass plus your exam. Good luck on your exam.